Good morning. This is Dr. Susan Mara with Dr. Mara's Medical Minutes and Juju, my 13-week-old French bulldog who's in training to be a therapy dog. Aren't you, big girl? And today we're going to talk about the use of hyperbaric oxygen in hypermobility EDS or Ehlers-Danlos syndrome. So what is hypermobility Ehlers-Danlos syndrome? Well, that is a condition that is genetically influenced, where your ligaments and tendons are rather loose. And I can give you an example because I have a variation of Ehlers-Danlos. See how bendable my fingers are, and I can take my thumb and I can stretch it all the way to the underside of my, there you go, all the way. So this is not full-blown Ehlers-Danlos, but I'm on that spectrum. So I'm at a much higher risk for developing I'm at a much higher risk for having accidents, like, twisting my ankle, having a knee give out, hyperextending your elbow, things like that. Things where the ligaments are involved in the in the injury. It's a genetic thing, and however, it does become worse when you have MCAS and POTS. So that triad of EDS, MCAS, and POTS. And there's a septad, and there's a pentad, and there's all these TADs. But the triad is EDS, POTS, and MCAS. And it's thought that with activated mast cells and them releasing 1,000 molecules, one of which is histamine. Histamine is very hard on the ligaments, and it likely degrades them. Hello, love. Good girl. It likely degrades and puts pressure, degradation pressure on the ligaments, and so they become looser. And so the way that you can think about it is, in a normal person, their ligaments are like a rubber band, and they go like this. And people like me and other people with EDS, when you stretch the rubber band, it doesn't go back so easily. So there is a loss of resilience in that tissue. And as a result of that, oftentimes people with EDS are very, very poor wound healers. And this is where hyperbaric oxygen comes in. Hyperbaric oxygen is wonderful for delivering oxygen under pressure, usually 2 atmospheres or more, to tissues that have been wounded. And hyperbaric oxygen is a great method to heal injured tissues, diabetic ulcers, burns, things like that. And it's also really useful in healing the brain for Parkinson's or ALS or things like that. So people with hypermobility EDS, which is called small h EDS, are quite likely to get a huge amount of benefit from hyperbaric oxygen. And I'm actually going to get certified in this because I think it's such an important healer that I'm going to get certified in hyperbaric oxygen treatment. And hopefully I'm going to get a hyperbaric oxygen chamber, and I'll be able to deliver hyperbaric oxygen to my patients, maybe even to Juju. I don't think Juju needs it, but. So, take-home message, hypermobility EDS, you might want to try hyperbaric oxygen. There's a couple of places here in Seattle, although not very many, and you might want to give it a try and see if it does help with your condition. Okie dokie, you take care, have a very wonderful weekend, and Juju says, bye-bye. Bye-bye. All right, love.